Hello everyone, I am Dr. Vandana Krishna Prasad, Senior Fertility Specialist at GarbhaGudi IVF Center. Today we'll discuss about an important topic, Premature Ovarian Failure or POI. What is Premature Ovarian Failure? Normally, majority of women attain menopause after they cross the age of 40 years. But nowadays, what we observe is there is a rise in a trend in the women attaining menopause at less than 40 years of age. In between the age of 30 to 40 years, we see that 1 in 100 women attain menopause. In between the 20 to 30 years of age, 1 in 1,000 women attain menopause. Isn't it surprising? We always tend to think that menopause comes later on in part of age of life, like maybe at 45 years, 46, 47. But nowadays we observe that people are attaining menopause at a very young age. If a woman attains menopause at less than 40 years of age, that is called as premature ovarian failure or premature ovarian insufficiency. What is the cause for this? There is a lot of causes are there. In some women, we don't know what is the cause. Number one cause is genetic cause. Some of these women might be having a syndromic like Turner syndrome or triple X syndrome. In these patients, what happens is the ovary loses the ability to produce eggs. So once the eggs have totally been exhausted, the menopause sets in. No more periods come in that patient. A second cause is the immune cause. What is this immune cause? What happens? The patient develops, the immune system starts working against the patient's own ovary and starts destroying all the eggs which are there in the ovary. So with the loss of exhaustion of all the eggs, the patient attains menopause very early. Next reason is the environmental toxins. The kind of food habits the junk food what we use, processed food what we use, carry these toxins and they have a negative impact on the ovary and the reserve of the ovarian. Some of the patients might have received radiotherapy or chemotherapy because they must have had some cancers, and these radiotherapeutic agents and chemotherapeutic agents, they are harmful for the oocytes and they destroy the oocytes. Other causes is they might have undergone some surgery, ovarian surgeries, or might have got infection of the ovary. So this also destroys the ovary, and so exhaustion of the eggs in the ovary leads to the earlier attainment of menopause. How do these people come to the doctor? They usually complain of symptoms like they used to get periods regularly, but of late the periods are getting delayed. They come once in 2 months, once in 3 months, or maybe some people might say that in the past 1 year there is no periods. That means this period starts becoming lesser and lesser. They attain menopause. Some people come with the infertility problem. They have been planning for pregnancy for 1 year, 2 years, but they are unable to conceive. Few of them come with post-menopausal symptoms like hot flushes, night sweats. They might be having some bone pain, osteoporosis-like symptoms. So these are the various symptoms the patients approach the doctor. Now, how do we identify that this patient has attained premature ovarian insufficiency problem? We need to do a scan for these patients and see the ovarian reserve, whether the ovary has got the ability to produce eggs. There are some blood tests like AMH, FSH and LH values. These values help us to know whether the patient has attained menopause early or they are going towards the attainment of menopause. Next, what is the next plan of management for these patients? Can this ovary aging, can it be arrested? No, it cannot be arrested. It is an ongoing process. So we can identify some, like ask the patient to undergo lifestyle modification, like habits consuming like alcohol or cigarette smoking, or they have caffeine addict. We'll ask them to avoid all those things, avoid stress, eat healthy food, exercise, yoga, meditation. These stress lifestyle modification might help to some extent to arrest the process, but it will not completely stop the process. Next step is, if they have approached us for infertility problem, we should encourage the patients to go for the next higher level of treatment than to go for simple treatment. High level like IUI or IVF is the swift method to achieve pregnancy, because if you keep waiting for a longer time, there is a possibility that whatever eggs is there, then also they can lose. Whenever a patient comes to us and we are suspecting premature ovarian insufficiency, if it's an infertile patient, the advice to them is become pregnant as earliest as as possible before they exhaust all the ovaries. Otherwise, they are left with no of their self-eggs left. They may need to go for donor egg. Thank you.